afternoon. Thank you so much for being here, both in person and online. I'm Keisha Pollock Porter, Dean of the Bloomberg School, and it's a pleasure to welcome you to our first Dean's Lecture of 2026. This series was first established under Dean Al Somer, and it gives the school the opportunity to highlight the work of newly appointed and promoted professors and senior scientists. This seminar gives us an opportunity to hear firsthand how they are changing the world through the power of public health. And today I am thrilled to introduce my friend and colleague, Dr. Erin Hager, who I first met many, many years ago at the Active Living Research Conference, which is one of the few professional meetings where one of the entire afternoons of the conference is devoted to physical activity break. And Erin and I oftentimes shared those breaks together and wore sneakers, and it was strongly encouraged to do so. And Erin and I have had a chance to work together on projects, and again, it's just such a privilege to get to introduce her today. Before I do, I want to ask all of you just for a moment to think back to your time in grade school. Everybody thinking about that time? Think about how you spent time in the cafeteria and outside playing during recess. Maybe you remember getting pizza on Fridays that was like in that square. It wasn't even a slice, it was that square piece. Or those little milk cartons. You know, those memories stay with us. And for some children at school today, they don't have access to health promoting meals and to opportunities for physical activity and play. And I hope that you'll hear today or come to the place by the end of Erin's lecture that you just see how incredibly important her work is. Erin, we are proud to say, is an alumna of the Bloomberg School, and she's a professor in the Department of Population, Family, and Reproductive Health. She's a nutritional epidemiologist who works to promote healthy eating, physical activity, and food security for children. Erin helps bring evidence-based policies and programs into homes, schools, and communities, transforming the spaces where young people live, learn, and play. She began her career by focusing on obesity prevention through behavior change strategies for individuals, working on several NIH-funded obesity prevention trials with Dr. Maureen Black, who's here today. Today, Erin incorporates behavior change strategies into the design and implementation of multi-level interventions. By looking for ways to drive change through policies and systems, she has expanded the reach and impact of her work. And let me just give you a few examples. In 2010, Erin worked with colleagues to demonstrate the effectiveness of a simple 2-question screen that could identify families experiencing food insecurity. The paper from that work has been cited hundreds of times, and in 2015, the American Academy of Pediatrics recommended its use for all children. Erin was also the driving force on the Maryland Wellness Policies and Practices Project. For 8 years, the project provided guidance and assistance to help schools create comprehensive wellness plans and put them into school, promoting both good health and academic success. And just 2 months ago, Erin and her colleague, Rachel Deitch, had a gathering of researchers, educators, and policymakers in Washington, D.C. to focus on the importance of recess. The event served as a launching pad for a policy toolkit that can help advance strong research policies at the state level. I'm especially excited about this because the policy toolkit was a concept that was created through partnership with the Bloomberg American Health Initiative. And Erin was the first to launch one of these toolkits to great success, which helps lays the groundwork for more in the future. And this is just a small snapshot of what Erin does. In addition to her research and practice work, she served on national public health advisory boards, as well as the Baltimore County School Board. She's also a devoted teacher and mentor and has worked with dozens of trainees, co-authoring papers with many of them. She is deeply valued by her colleagues and has been described as one-of-a-kind boss. Erin is someone who generates excitement for her work and the work of those around her, and she is deeply collaborative. And through all of these efforts and more, she has been such a strong asset to our school, and I'm so glad we were able to recruit her in 2022. At a time when federal funding and policies are fraught, Erin is showing us that we can drive powerful change at the local and state level. Erin, thank you for all you do to support schools and communities in places where all young people can thrive. We are excited to hear from you today. I also want to take a moment and shout out Erin's family who's in the room and also online. Thank you for being here as well. And I'm going to turn the podium over to Erin to give us our lecture today. We'll have time at the end for questions. I'll run one of the mics, as will somebody else, Becky from the Dean's office. So Erin, the floor is yours.
All right. I am so excited to be here today to tell you a little bit about the work that we do in our research program. And so the title of the lecture that I put forward is Healthy Eating and Physical Activity in Schools, Partners, Policies, and Practices, but I'm going to tell you a little bit more about other things that we do as well. I was told that in these types of lectures, you're supposed to talk a little bit about yourself at the beginning. And so if you've ever met me, and you'll probably learn in the first 5 minutes that I'm a Baltimorean. I tend to bring that up really early on in conversations. My family, when I was young, we lived in the city. We moved to the county. My dad still lives in Arbutus. If you are also a Baltimorean, then the answer to the question that you're dying to ask me is that I went to Lansdowne High School, which is, of course, the ultimate Baltimore question. And then I went all the way north in Baltimore to Loyola College for undergrad, where I studied cell molecular biology, and I had the opportunity to work at the Carnegie Institution of Washington Department of Embryology while I was an undergrad, and that was where I really learned to love science. And so this was an opportunity to do basic science, but I got to do my own experiments and test my own hypotheses and interpret my own findings, and I just loved it. And so after undergrad, I did some breast cancer research here at Hopkins in the School of Medicine. But along the way, I realized I also didn't like pipetting that much. And so I wanted to do something with people. I was also a personal trainer at the time, and I just thought, how can I do this science thing, but also merge it with health promotion with people? And that's when I learned about public health, because I really had never heard about it prior to that. Now I love that kids know what public health is, but back then we didn't really talk a lot about public health. And so I ended up choosing the program here in the Department of International Health and the Center for Nutrition, not just because it was in Baltimore, which is, of course, a perk, but because at the time there weren't very many programs around the country that focused on nutrition and physical activity. And there was this faculty member there at the time named Margarita Truth, who was an exercise scientist. And so I thought, if I can work with her and also get a degree in nutrition, then I can maybe form myself into this obesity prevention researcher. And also at the time, I was really interested in school wellness. It was really the thing that I would think about when I would think about how can we promote health and wellness among kids and populations. It probably should start in schools. And I received free meals as a kid in schools, and so I knew that the lunch program maybe could use some help. This was back in the 00s. And so I thought that this would be a great program to achieve those goals, and it certainly was. And so while I was here, I learned so much, and I got to work with Margarita to learn about physical activity assessment, and I still to this day do a lot of accelerometer work in my research program. And I also met Maureen Black. This is actually a photo from my dissertation when I was pregnant with someone who's in the room here today who happens to be 18 now. So Maureen Black is a psychologist. And so by working with Maureen as a graduate student, I learned more about individual behavior change theories, and how to approach questions in a slightly different way than when we learned in public health. So all in all, my time here was very, very meaningful and really set me on a fantastic trajectory. And so soon after I got my PhD, I got my first faculty position in the Department of Pediatrics in the Division of Growth and Nutrition in the University of Maryland School of Medicine, which is also in Baltimore, by the way. So that worked out. And I'll tell you more about my time there when I was at University of Maryland. And then as Dean Pollock Porter mentioned, I came to Hopkins in 2022 to the Department of Population, Family, and Reproductive Health. And so I'll tell you more about kind of my work over these two institutions throughout my talk today. And one thing that we did when we came here is we established a name for our research program. So we call ourselves the Strong Research Program, which stands for Striving to Reach Optimal Nutrition and Growth. And our mission is to promote children's healthy growth and development where they live, work, and play through research on policies and programs for families, schools, and communities. And I want to highlight these words, live, work, and play. So we're thinking about kids, right? So if we think about where they live in their homes, and their home environment can be very important. They work in school, and so the school environment can be very important, and they play in their neighborhoods. So the community and neighborhood environment can also be really important when and my research program specifically thinks about healthy eating, physical activity, and promotion of food security for kids and families. So the public health people in the room are probably thinking, that's a social ecological model, which it really basically is, and that's kind of how I've thought about my research program over the years. And no social ecological model is complete without a policy layer at the top, and that really is what helps to drive all the work that we do in these different environments, and so cross-cutting across the different levels of the model. And so again, my talk today is going to be mostly about schools, but I want to start by telling you about the work we did focused on the home environment, which was early in my career. So here's a picture of when we were all very young, when we first started at the University of Maryland School of Medicine. And one thing that I really appreciate that happened when I joined the faculty there is that Maureen Black actually recruited 4 assistant professors within a short period of time. Some of you may know the other folks in the slide. Yan Wang is at GW now. She's still a strong collaborator. Margot Candelaria is now at the University of Connecticut, and Kristen Hurley is faculty here in International Health. And so we all got to grow up together as assistant professors, which was really impactful. And we were all focusing on randomized controlled trials to help promote healthy eating and physical activity for families in their homes. And so from this work, we learned about how to structure a randomized controlled trial, how to execute an intervention and analyze the data, and it was an incredibly meaningful experience. And I also had an RO3 early on to employ ecological momentary assessment measures into this toddler study called TOPS. And by doing that, so ecological momentary assessment is a way to capture lots of data at one time. So intensive longitudinal data. We're in a survey. We did it on a Palm Pilot, so I'm going to keep dating myself at the beginning of this talk. But we were able to capture lots of data and understand more about how toddlers and their parents interact with their home environment in real time. And so again, another kind of tool to add to my toolbox in addition to the accelerometry measures that I was working on. So as far as the neighborhood environment is concerned, my very first grant that I ever got as a faculty member was a Robert Wood Johnson Foundation Active Living Research New Connections grant. And that allowed me to explore the role of the neighborhood environment in physical activity behaviors of adolescents. And that really led me to pursue a K award that I got through the Birch program, which I know we have here at Hopkins as well, where I learned about GIS measures and how to assess the neighborhood environment. And so several papers came out of that work. One of the more meaningful projects, which I've actually been talking about a lot recently, randomly, was a physical activity map of Baltimore City. So in Hopkins, we talk a lot about our food desert maps, which is a really important work that has been done out of our Center for Livable Future. And this was actually in partnership with those folks where we developed a physical activity map of the city as well. So again, a lot of research, but also practical work came out of those projects. But all along, I was really interested in schools. And so throughout my time at University of Maryland, I was able to weave in a lot of work with schools and became very interested in school policy, which is what we're going to be talking about today. So healthy eating and physical activity in schools. And again, the subtitle of the talk was Partners, Policies, and Practices. And so starting with partners, so I was at a scientific meeting probably in 2015, and our colleagues Kelly Brownell and Christina Roberto presented this paper on strategic science. And when they presented it, I was like, hey, that's what I do. And so I got really excited about it because it really summarized how my team would approach research questions. And so from then on, I've been using it ever since. I should probably tell them how often I use this concept. But the idea of strategic science is that you identify change agents. And so if we're talking about schools, these are partners with the ability to influence school policy. So state departments of health and education, local school districts, local governments, schools, you name it, this is just a short list. Then together you develop strategic research questions. And then together you do the scholarship. So I've written lots of grants with folks at the school district level, for example. And then together you create a communication strategy to provide the information back to the population you're working with. But also together, by interpreting the data and identifying what the next steps are, you restart the process again. And so again, I'll use this framework throughout my talk today to describe some different ways you can use strategic science to advance policy and practice. And so speaking of policy and practice, I like to use this very simple graph to think about the different policy levers with respect to schools. So there are federal policies, state policies, school district policies, school policies, you could probably add classroom policies, and keep going even more further down than just what I show here. So I have 2 audience questions for everyone in the room. The first one has to do with foods and beverages in schools. So the question is, how and when are foods and beverages provided or sold to children during the school day? Anyone? You all went to school at some point. Breakfast and lunch, so the school meal program. So the National School Lunch Program, school breakfast program. How else do kids get food provided to them by the school? Celebrations, pizza parties, cupcakes, all those things. So a kid comes into the school, they don't have it with them, but they leave having eaten it, right? So that's provided them by the school. There's one other way I was going to mention. Well, vending machines, oh, so 2 more ways, yes. So they're on my list, I just forgot what I was gonna say. Yes, snacks, so snacks that are provided or sold to students during the school day, vending machines, other bake sales, things like that can be done. But there's one more that I was thinking of. Anyone? All right, I'll give you the answer. So school meal programs, snacks that we just talked about, celebrations, and rewards. So another way that a kid will come to school without food and leaves with food in their belly is that a teacher will give them a piece of candy for having done a good job, or some other reward from food. I'll answer the second question for you in the interest of time, which is what policies guide the provision or sale of food and beverages in schools? And so for foods and beverages, we have policies at the federal level, like the National School Lunch and Breakfast Program, Smart Snacks, which oversees the snacks that are provided in schools, the Community Eligibility Program, which actually provides free meals to kids in schools and school districts, and which also is a way to combat food insecurity. At the state level, we do have some policies as well, including things like the universal free school meal programs that we hear a lot about in the news. California just passed an ultra-processed food law that's going to be rolled out, so some states can do some cool things. And then as far as especially celebrations and rewards, those tend to be lumped into something called a local wellness policy, which occurs at the school district level, and I'm going to talk more about that in a minute. My question for you, though, is physical activity in schools. So when and how are children physically active during the school day? Recess is one. What else? PE class, right. Anything else? Not that many kids are active during lunch, but maybe. Well, this is during the school day. So yes, active transportation is outside of the school day, but that's in sports. So the other ways are typically activity breaks, so brain boosts, things like that, where the teacher stops instruction and you get out of your seat and you move around, or integrated activity, which is an intentional use of physical activity for like a lesson plan, but during a classroom, so maybe during math class or something like that. So as far as policies around physical activity go, the answer is much shorter because there are no federal policies for physical activity in schools. As far as states are concerned, during the introduction, you heard that our team did a recess policy package that was funded by the Bloomberg American Health Initiative. And in doing that, we learned that only 10 states have strong recess laws. So there are 26 states that have some sort of physical activity recess combination law that's a little on the weak side, or some of them are on the weak side, but only 10 of those 26 have strong recess laws. And there are more states that have some PE laws, but again, it's similar in that it's not very uniform. So it's a little bit of a mix-up for states. The local wellness policy is where you see a lot of these physical activity policies go into effect, but they're at the district level, so they can be, ranging in strength and comprehensiveness. And then, of course, there could be some different physical activity policies in schools. But the last question is, where does the majority of the implementation of policies in schools take place? Or I just answered it in my question. Oh my goodness, where does the majority of implementation of these policies take place? The answer is schools. So we really need to think about how we implement all these policies by focusing on schools. And so I'm going to give you 3 examples from our team about the focus on partners, policies, and practices related to healthy eating and physical activity in schools. And so the first is an example of a state and district partnership for local wellness policy implementation. The second will be around school partners for wellness policy implementation. And then the third about national partners for policy research and evaluation focused on school wellness. So before I talk about wellness policies, I assume not many people in the room are familiar with this concept, although it's been around for quite a while. So this wellness policy is actually stemmed from legislation that passed in 2004. And this federal policy stated that any school district that participated in a school meal program had to have a wellness policy in place by September of 2006. So it was kind of long ago. And at the time, the wellness policies were required to state that school meals would meet the minimum federal standards for the nutrition guidelines. They also had to have language around foods and beverages sold outside of the school meal program. They had to have goals for nutrition education, goals for physical activity, and an implementation plan. And that was what they were back in 2006. But as you might imagine, they can only be effective if they're implemented. And so I use this schematic to talk about wellness policies a lot. Again, this federal legislation passed, which led to these written local wellness policies at the school district level. Implementation occurs at the district and the school level. But the implementation should lead to enhanced opportunities for health and wellness for students, which is why they were put into place to begin with. And then these enhanced opportunities should lead to improved child health and academic outcomes. And this was really the goal of wellness policies back in 2004. But many noted through research that these policies weren't being implemented. And so fast forward to the Healthy Hunger-Free Kids Act of 2010. So if you're in my school nutrition world, this was a huge policy that changed school meal standards, the smart snacks concept. Lots of things were included in this big federal legislation, but it also included language around wellness policy implementation. And so because it had so much in it, the wellness policy piece didn't go into effect until 2017. So a little bit later, and now we're getting a little more current, right? And so there were many changes to the content of the wellness policies, including they had to address food and beverages provided but not sold, which goes back to those celebrations and rewards that we were just talking about. They had to address food and beverage marketing, so anything that was marketed to kids had to be the same types of foods that would fall under the smart snacks umbrella, meaning that they had to be, healthy-ish. So remember those Coca-Cola signs in your gymnasium growing up? So that's no longer allowed under this federal legislation. They included public involvement, and there were a lot of other changes that took place. But I would argue the biggest change is this triennial assessment. So in the wellness policy final rule, starting in 2017, it said that every school district had to report on how their wellness policy compared to a model policy, and how every single school in their district was doing as far as compliance with the wellness policy. And that report went to their State Department of Education, and then that went to the USDA. So it was a very formal process. And so that's the background on wellness policies, and I'm going to keep talking about that throughout my talk. But I'm going to start by talking about the Maryland Wellness Policies and Practices project that was mentioned actually in the introduction as well. So this story actually, so Dr. Sharfstein just walked in the room. So way back in 2012, the state actually got a community transformation grant from the CDC. And so this was a very large grant that included a lot of pieces. And so, we were honored to be approached by the health department. Dr. Sharfstein was the commissioner of the state health department at the time to work on this childhood obesity prevention angle. There wasn't a lot of money involved in the approach, but we were paired up with the State Department of Health and the State Department of Education to figure out how we could address childhood obesity in Maryland. And so we sat in a room for 3 hours and we hashed out this goal. And again, this was back in 2012. And the goal was to enhance opportunities for healthy eating and physical activity for Maryland students by helping schools and school districts create and implement strong and comprehensive written wellness policies. So this is a great example of strategic science, because I went in there never having heard of a wellness policy, and we left with a goal that focused on this for this project. And so this project lasted for 8 years, and throughout the entire 8 years, the goal was the same, where we were trying to promote wellness policy implementation. If you're not familiar with Maryland, every county is a school district. It's a really different model compared to a lot of states, but that means we only have 24 school districts, public school districts. They do range in size dramatically. So some have 200 schools, some have under 10 schools. So they have a lot of different needs and different infrastructure within the school districts. But there are about 1,500 schools, about 900,000 students in Maryland. And so back to the schematic about wellness policies, we sought to look at the quality of the written wellness policies in all 24 districts. Again, we're only working with 24, which worked out well for the project. So we assessed the quality of the written language. We also administered a survey to the 24 districts, but also every school in Maryland, to understand how they were implementing wellness policy best practices. And we also looked at the impact of the wellness policies with respect to academic outcomes. And so again, this is 8 years. So we got to do the data collection every other year over this period of time. And then we designed it so that on the off years, we would actually go to every school district in the state. And this was back before people used Zoom. And so we would go in person and present our data back to them. So we provide them with their data, we provide them with a report, and talk to them about their goals around wellness policies. So this is really a continuous quality improvement model. So we would collect the data, we provide the tailored district level feedback. Because we had these partners in the Department of Health and Department of Education, we could provide technical assistance, resources, support to the districts and schools. This would lead to district level wellness initiatives, lead to school level wellness initiatives, and then we capture those changes each cycle with this data collection. And so I also mentioned that this triennial assessment went into place in 2017. So when we designed the study in that room where we sat for 3 hours, we also knew there was language in the Healthy Hunger Free Kids Act about wellness policy implementation. We just didn't know what would happen with it. We didn't imagine it would take 5 more years to actually come to fruition, but it did come into play in 2017. But because the triennial assessment was the real kind of turning point of how we might be able to help encourage wellness policy implementation, that wasn't going to go into effect until 2020 because it's 3 years later. And so one cool thing about the project is that we got to help the school districts meet their triennial assessment requirements because we were already collecting the data. So we became a really great resource for them. So we could provide the school survey, the model wellness policy, all the things they needed to help them meet their triennial assessment. So Maryland was in great shape by the time June 2020 rolled around. But there was something else going on that you may remember. So the pandemic made it so that the triennial assessment wasn't due until a year later. So we were still able to help the districts get over the finish line, but because schools were closed and everything else was going on, our funding abruptly ended at that point. But we had gone on for 8 years, which is such a remarkable thing for a research project. And we're really proud of the value and impact of this project. So we contributed to a lot of research papers, including things around wellness policy implementation measurement. A lot of the items from our survey are still used in surveys around the country. I'll tell you a little bit more in a minute about school-based wellness teams, but that was something that we learned a lot about through the data and this project. We saw actual policy change happen in these districts. So this is just an example of one district that changed the language in their policy from foods and beverages should not be offered as a reward to they will not be offered as a reward. That seems small, but it's actually a really significant change in policy because it says they can't be done, not should not be done. We also were able to document differences in wellness practices over time in the different districts. We have all these reports. This is just a few of the reports that we generated through this project, and they all document these changes over time. And then with our partners, we were able to identify the supports that districts and schools need to implement their wellness policies, and these supports are still being offered around the state. And our partnerships still continue. The picture at the bottom is when our project coordinator went off to medical school, and everyone and all the departments got together to throw her a party. So again, these were really genuine partnerships. And when the funding ended in 2020, we were immediately asked to help evaluate how school meals were being implemented during the pandemic. And so then we had a new project with MSDE, and we were asked because we were there. We were at the table, we had been a good partner for 8 years, and so we continued that partnership through this 2-year project around COVID-19 school meal implementation. And then we just finished a project around local food procurement in schools. So we keep working with them. It's been really, really rewarding. And so that's that example. Now I'm going to move on to, and they're all linked. So I'm going to move on to Wellness Champions for Change. So I mentioned that one of the things that we learned from the Maryland Wellness Policies and Practices Project was the importance of school-based wellness teams in supporting wellness policy implementation. So we had a paper that just looked at factors related to wellness policy implementation, and we learned that school-based wellness teams are really important. We had another paper that looked at active wellness teams, if they met frequently and had the right people on them. Turns out they were more impactful. So that was we made an active wellness team score that others have used in research. And then I worked with a preventive medicine resident to do an analysis of 2 time points. So just looking at whether schools had a wellness team at 2 time points, and it turns out that's the red bar, they were able to maintain a high level of wellness policy implementation. The schools that never had a wellness team, that's the purple bar, they maintained a low level of wellness policy implementation. The blue bar is when they built a wellness team, and then the green bar is when they lost their wellness team. So the pattern really demonstrates the role of wellness teams in supporting these practices in schools. And so this graphic has been used in CDC reports and lots of other ways to encourage schools to really consider building these wellness teams. And so the data that we were analyzing for MSDE or in our partnership was really compelling to them and to us. And so we decided to work together on a pilot study through a mechanism called USDA Team Nutrition. So this is a funding mechanism that can only be applied for by state departments of education. And so we actually, throughout our partnership, had 3 of these with the State Department of Education. So it was a really wonderful way to collaborate on research projects. But the purpose of this one was to develop an intervention that included a teacher training for leading wellness teams. And we were going to look at the school level impact using the Maryland Wellness Policies and Practices Project Survey. So again, all integrated. And we found that the teacher training indirectly led to higher wellness policy implementation through the formation of these active wellness teams. And so this was a really good finding for a pilot study in, I think it was 60 schools in Maryland. And we did a randomized approach to doing this. So given the positive findings, we submitted and received a large amount of funding from the USDA to do this RCT, where we added looking at the impact of student-led wellness teams, so not just teachers, but what if students form their own wellness teams in schools? And then we were looking at the impacts on the students, so looking at student diet, physical activity, and weight status. And so I don't have a whole lot more to say about this project because it was disrupted by the pandemic. Very sad. So in the middle of the pandemic, we weren't able to continue on and see the impact of the intervention on those student level impacts or student level outcomes that we intended. However, the project did make significant contributions to school wellness measurement, to looking at how policy and environment in schools are related to teacher health behaviors and student health behaviors. The teacher piece in particular is really novel for this project. In addition, this project actually led to an NICHD R01 that we call the COVID-19 Family Study. So this project, we were able to recruit those families that participated in Wellness Champions for Change and follow them throughout the pandemic because we had all this rich baseline data that we had collected as part of Wellness Champions for Change. So it's still going strong. We're actually wrapping this project up this year. We also had a lot of practice wins from this project. Towards the end, we developed an online version of this teacher training that was really well received, and our partners are still using components of that training in their work throughout the state. Under the umbrella of this project, we had 2 postdoctoral fellowship awards and 2 K awards. So that's really remarkable to be able to support the next generation of researchers under the umbrella of this project. And again, the partnerships continue. So we actually just got funding from the Bloomberg American Health Initiative to adapt the Student Wellness Champions for Change curriculum to be a district level intervention and focused on high schoolers. And we have a bigger grant under review to evaluate an adaptation of this program. And our partners at the State Department of Education have actually done a 3-part webinar series this year through the State School Health Council to promote wellness policy implementation, in part, again, leaning on some of the lessons learned from these 2 projects. And so I think I always say when I get excited, I talk like an auctioneer. So I'm going really fast here. So I apologize for how fast I talk. So the 3rd example I wanted to share is the CDC NOPRIN-PAPRIN School Wellness Working Group. So NOPRIN stands for Nutrition Obesity Policy Research Evaluation Network. So I know it's a mouthful. And PAPRIN stands for Physical Activity Policy Research Evaluation Network. And actually, Dean Pollock-Porter used to lead PAPRIN back in the day. So these organizations have been around for a long time. So back to the Maryland Wellness Policies and Practices Project. So there wasn't a lot of funding for this project. And so we sought additional funding to kind of build it out and expand the scope. And so we were able to get funding from NOPRIN to expand the Maryland Wellness Policies and Practices Project. And one of the kind of rules when you got a NOPRIN grant was you had to join a work group. And I didn't really have one that they listed that really met like what I did at my research. And so I was at Active Living Research with probably with Keisha, and that's where I met Lindsay Turner, who had done a lot of work around wellness policies. So I was excited to tell her about our new project and tell her about this work group thing. And we said, let's make our own work group. And so we did that. And so we proposed a new working group under this umbrella of NOPRIN and later PAPRIN. And it started in 2014, and it's still going, which is really exciting. And so Lindsay stepped down in 2020, and Juliana Cohen, who folks in the school wellness world certainly know both of these names, became the other co-chair of the working group, but we're still very active. We have CDC liaisons that we work with. We meet in person. We have writing retreats. We've published over 20 papers. We have these monthly webinars. And probably our biggest success is we've started a fellowship program. So we bring on a doctoral student or a postdoc each year, or 1 to 2 a year, to be our fellow and help kind of run the work group, but also do a fellow project. And so I'm not going to name everyone here, but you might recognize some of these folks. Amzie Heck, for example, did her PhD here at Hopkins. I do want to highlight 2 of these fellows who were my postdocs at the time at University of Maryland. So Hannah Lane, who's now at Duke, Ann Kuhn, who's now at University of Buffalo. And so having this extra experience really helped to boost their national profile and also allowed them to publish with lots of folks from around the country. So it ended up being a real win-win for these trainees. So again, we've had 11 fellows to date. The second fellow I want to mention is Nan Do, who's in the back, who was our fellow from 23 to 24. And she actually just got an assistant professorship at UT Southwestern in Dallas, and is going to be leaving us in the summer, but we're very, very proud of her. And again, this experience helped to elevate her national profile. So again, I think it's a really wonderful model for as a little add-on project for postdocs and trainees. And so we've had a lot of impacts, I would argue. We've hosted over 100 or about 100 webinars. We have over 200 members in our work group, especially one highlight is we have researchers and practitioners. We've had, again, lots of papers. We did contribute to this COVID-19 nutrition implications ad hoc work group, formally as the school wellness work group, and it helped to kind of elevate that work group as well. Again, having those 11 fellows has been really the biggest success of this overall work group. And then just recently, we were invited by the Healthy Eating Research to contribute to a national research agenda for policy systems and environmental strategies, focusing on children and adolescents. And so this is a commission project, and we were invited because of the work we had done the last 11 years. So it's, again, a really wonderful example of bringing folks together around a single topic. So I went through that way faster than I planned. I went in summary, as far as partners, policies, and practices go. Healthy eating, food security, and physical activity policy levers for schools exist at all of those levels. So the federal, state, local, and school levels. And using strategic science can enhance the link between science and policy, including implementation. And I would argue that strong partners, including the ones that we've worked with for so long, can support research, policy, and practice, and they're really important to have at the table in a very meaningful way. And so as far as our team is concerned, we still have lots of other projects going on. I know I talked about some things that were in the past and how they link to things in the present, but just 2 other projects to highlight. Literally last week, we presented a project to the Baltimore City Schools Cabinet, which was an evaluation of a pilot program that city schools did, where school lunch was provided for free to all staff. So think about it in schools where kids are getting free meals, the teachers and staff aren't getting free meals, and sometimes they can't even buy them. So it's really complicated, it creates a complicated dynamic. And so the school district wanted to do this, and so we were able to, again, get funding from the Bloomberg American Health Initiative to design an evaluation of this, and we created a report, and we presented it to the cabinet last week, and now we're trying to design the next research project that will follow this. We also, as you heard, created a policy package for state recess laws. And so if you are interested in learning more about that, the policy package is on the Bloomberg American Health Initiative website. Since the convening that we hosted, which was the week before the holiday break, we have met with many states who are really interested in putting forward state recess laws. And so this could actually make a change, which is really exciting to think about that nationally. And I did want to mention after the convening, NCORE reached out, so that's the National Collaborative on Childhood Obesity Research, which is an entity that's NIH, USDA, CDC, and Robert Wood Johnson Foundation. They all work together, and they want us to do a recess webinar. So again, following this work to kind of keep it going. So lots of opportunities are arising with respect to recess. We have new projects under review, as keep your fingers crossed about those. And then we do see that there will be hopefully opportunities under the MAHA movement. There's a big focus on food as medicine at NIH right now, so that could be an opportunity as well. And I really think that this physical activity focus could be an opportunity. It seems to be something that a lot of people agree on, which is a nice thing. And so we could potentially leverage promotion of physical activity moving forward in our research program. And we continue our collaborations with internal and external partners. And I always have to end my talks telling folks what they can do to get involved. So I think it's really important to be active in your research and figuring out ways to, again, bring people together and support the work that's happening on the ground. So if you are in the room and you had never heard of NOPA and RepHapron before, I recommend going to their websites and signing up. It's a very simple thing. You just get some newsletters and some webinar invitations. If you're interested in school wellness research, you could certainly join our work group. We'd love to have you. Again, you just get some emails and some webinar invites, so it's pretty simple. I didn't mention the Maryland State School Health Council, but if you're interested in Maryland wellness initiatives, I also chair the State School Health Council. I've been doing that since 2018, and so again, we'd love to have you. And then if you want to get involved in school wellness initiatives in a specific school district, in Maryland, every district has a local school health council. So again, all 24 districts have one. So if you want to get involved, I'm happy to connect you with the district school health council chairs. If you want to support wellness initiatives in a specific school, if you're a parent, if you have a kid you care about, that you want to get involved, then you could join or start a wellness team. So we have lots of resources through Wellness Champions for Change that we're happy to share with you. Again, it's a great way to promote health on the ground in real life. And of course, if you want to learn more, Susan Gross and I teach classes in the first and second term that cover a lot of these topics. So if you're a student and are interested, we'd love to have you take our courses. And Pam Martin and I are also teaching a management course this summer in the Summer Institute around managing people and projects in public health. That is going to be really fun. So I'm happy to talk more about that course as well. So I actually have some really fun pictures to follow this slide, but I do want to say out loud that I want to acknowledge the funders that trusted us to do this work, the participants that volunteered to do the work, the partners for their generosity of time and ideas. That's part of the strategic science model. We share ideas and hopefully work together to see it through to fruition. I have the absolute greatest team of colleagues and trainees and collaborators, and have been so lucky to work with such amazing people. The Department of Population, Family, and Reproductive Health that recruited us and brought us in with open arms in 2022, and my awesome family and friends, of course. So here are my fun pictures. So I take a lot of pictures. So we had so much fun in our 13 years in the School of Medicine. Lots of parties. We volunteer a lot as a team. So we ran 5Ks and we volunteered to build a playground, and we like to do things that kind of speak to the work that we do. We carried that through to, there's missing a picture there. We carried that through to our time here at the School of Public Health as well. Again, we volunteered at Great Kids Farm, which is a farm that contributes to Baltimore City Schools. It's a great place to volunteer. The picture that's missing is us at the food bank. So we volunteered at the food bank. There's something else missing there. So again, lots of fun times. And even in PFRH, in just a couple of years, we've had so many great times celebrating successes and going on adventures when we're at scientific meetings and all that fun stuff. So I'm just so grateful again to have been welcomed with open arms to this department and to the program, or to the school itself. So I have to acknowledge my team, and I'm going to get emotional. They're the best. Maybe I'll just say that. No, but we have been together for a long time. So I didn't mention Elise Kowalski was a postdoc with us who actually just got an assistant scientist position here at Hopkins, so we get to keep working with her, which we're thrilled about. Nando, who I mentioned, will be heading to Dallas this summer, and we'll miss tremendously. And then Rachel, Raquel, and Janie have been with me, Raquel for over 15 years, Rachel for over 10 years, and Janie for over 8 years. So we've worked together for a long time through lots of things, and I'm very grateful. And Maureen, who has been my mentor and friend for 20 years. So it's been a long time. So I'm very grateful to Maureen for all of her guidance throughout my research career. And then my family and friends. So this is me at graduation. So again, the 18-year-old is in the back. The 20-year-old is on Zoom from her sorority house. And then my daughter Tatum is going to be 16 this Friday, and my amazing husband, and so many friends who put up with me through working on work when I should have been hanging out with them and vacations and things. I do want to note the folks in the bottom left, I all met here in Hopkins in my graduate program. So I'm just grateful to be able to continue those friendships as another way that carries forward in my life. And that is it. So I made it through.
Erin, thank you so much for sharing your story and a summary of the impactful work. And it's truly an honor and privilege to call you a colleague and that you're a part of this community. We have some time now for questions. And so please raise your hand, or if you're able, or if you're on Zoom, please, we have somebody monitoring the chat. And we have some time now for questions and comments.
Hi, Erin, that was absolutely wonderful. It's so great to see the different pieces that you brought together and the impact that you've made. I wonder, with the local wellness plans that you've been evaluating, are there like specific aspects of the local wellness plans that you feel like are most impactful? If you were like a school district that you're like, oh yeah, this part of the plan is the most meaningful and you should really work on implementing with fidelity?
It kind of depends on what the outcome is of your interest, of course. So they are one of the few places where you can include policy language for recess and PE and activity breaks and ways for kids to be active. So there just aren't other policies that exist for those types of things. So by having strong policies written into your wellness policy, especially for recess, that's a great way to ensure that the kids throughout the district get recess. And also those kind of celebrations and rewards. So that's the only place you see that language as well. And so often wellness policies get accused of being, the cupcake police and things like that. And the federal language says that it has to be addressed, but it doesn't say how. So your policy legally could say that kids can have a cupcake every single day, and that's totally fine. And then they meet the letter of the law. But most districts have really taken it seriously and realized that, celebrations can sometimes get out of control, so let's do one a quarter, or something like that. And so they can be creative and create kind of a culture where we think about food celebrations in a different way. And so I've seen those two areas used really well. And there is a bit of a momentum to think about wellness policies in a broader sense. So they were initially created to really focus on healthy eating and physical activity only, but should they include other aspects of student wellness? And so I think there are pros and cons of doing that. It can get everything a little bit watered down if you focus on too many things, but also there are a number of other aspects of school wellness that aren't anywhere in policy either. And so maybe this is the best home for them. So again, I think there are a lot of opportunities. And because this, triennial assessment didn't go into place until 2021, and it was a little mucky because of the pandemic, then the next one wasn't until 2024. Now we're really starting to use these and think about them. So I think this is definitely we're back at a position where we're in a good opportunity to leverage wellness policies to make real change in schools.
Thank you. I have to say, I met Erin when she was a graduate student, and just a few short years ago, and the transitions that she has made have been absolutely amazing. as Erin said, I'm trained as a psychologist, and you operate within the home and the child and individual behavior, and it spreads up a little bit into the community, but that's really where it is. And the transformation that Erin did is not me, it's Erin. So it's absolutely Erin that her eyes became open, that you could move beyond the child and the family into the community and into the schools. When Dr. Sharfstein, is he still here? When he gave us $50,000 to prevent obesity in the state of Maryland, I had absolutely no idea what could we possibly do. That was Erin. That was Erin. And reaching out to the Maryland State Department of Education. And as she said, it's the Department of Health, the Department of Education, and they were the partners and worked together. So it was really Erin. I learned a tremendous amount. Her example of you should not give cookies to you will not give cookies. Just the change in one word was absolutely amazing. So I think it's really a testimony to how you've been able to really make an impact. And Dr. Sharfstein should be very proud of that investment in those $50,000 because got a great bang for the buck. So there's lots more to come. And congratulations.
Thank you. I didn't mention it was $50,000.
So this is a fascinating presentation, and congratulations to you. And I have a question about like how you balance your hat as a scientist and also hat as an advocate, because sometimes researchers are not very good at like policy making or working with the policymakers and also be a good advocate of the evidence they generated. So any advice from your experience?
No, I thank you so much for that question. So yeah, I was very nervous to do any sort of advocacy early on. We kind of get some fears put into us about what we can and can't do, but there are a lot of things that we can do. And so during my my work with the State School Health Council, we partner a lot with the University of Maryland Carey School of Law, and they do really nice advocacy workshops about what you can do and what you can't do. And after that, I started testifying as a person, an individual person who lives in this community, and making sure that who I also happen to have expertise in this area, and so being able to work in that role. I also served on the school board for Baltimore County for 3 years, which was a very interesting experience. And I had to get permission from my school to do that role because it was, a second job, but also, an advocacy and policy making role. And to see things on that side, though, was really compelling. It's a lot of work, but if you ever have an opportunity to do something like that, I definitely recommend kind of really seeing how that happens, or even observing policymakers, in their natural habitat. So whether it's, going to Annapolis to the Maryland legislative session, going to school board meetings and seeing how this stuff gets discussed can be really important. But the biggest thing that I've been able to do in my work is to just do the research. So this recent project with the State Department of Education, we documented a process for advancing a bill. We even coded testimony and pulled out specific themes. We were able to get involved in policy making very much from a research perspective. And so it's definitely a fine line, though, and it can be a little bit challenging. And sometimes the data doesn't show you, what the advocates want it to say, and that is just the stance you have to, say this is what it is, which can be a little bit challenging at times. But yeah, so that's generally what we've done. We use our data. Sometimes they'll reach out, especially when we had the Maryland Wellness Policies and Practices project, and people would say, how many schools have recess? And I'd run the analysis and say, of the whatever schools I have, this is what the answer that we got. And then it could be data that could be used or not used for whomever's, goals were. So yeah, lots of opportunities, I think, are available to researchers to get involved in advocacy.
Thanks. I think to the last question, I'm curious,
well, one quick question, then another question. The quick question is, the $50,000 grant, given all of the relationships that it opened up, how much funding did that eventually
Oh my goodness,
support?
yeah, millions and millions and millions.
So I mean, I think part of the answer to that question is having a collaboration with a public agency may not appear to be the most lucrative thing in the first instance, but it actually generates connections and opportunities that can feed a whole career.
100%, yeah.
So my question is about your proposal to give everyone a cupcake every day. I want to understand that. No, sorry, never mind. Maybe I misunderstood. My question is, you've been in all these policy rooms talking about health in schools, and I'm very curious whether you think that the health benefits are driving that conversation or whether you need to have educational benefits. How do you think about, as you're doing these projects, whether, I mean, if our goal is, you know, kids who are doing well in school and healthy, in the educational world, how much of it has to be about education to be able to grow and sustain those programs?
I think it's like 80-20. Honestly, it's got to be education first. And it can sometimes be frustrating because you'll hear from folks to say, well, let's do the study to show that it impacts academics. And we're like, we've done the study. The studies exist. They've existed for 20 years. We know that if kids are more active, their brains are getting more blood. There have been basic science studies all the way to community level studies to show this. But it seems like we haven't really been able to translate maybe some of these things as well to our school level partners. Sometimes it seems like people want to see it in their school. It's this concept of like, well, would it really move my test score needles? And so I think we need to talk about it a little bit better because we have the data, it exists, but we aren't convincing the schools maybe as much that it's an investment in academics, because I think when you talk about physical activity and you talk about diet, we go to health. We're like, oh, that's good for your body, but it is also good for academic outcomes. And so the thing that drives decisions in schools is definitely academics. And one thing I always say is, I've had these kids who've been in schools, and when it's testing time, everybody gets breakfast, they get 2 recesses, everybody gets lunch. It's a marvel to see, because schools know that the kids need breakfast to do well on their tests, and so they're putting out healthy snacks. It's just a really interesting concept during those testing weeks. And so it really should be carried out throughout the school year to ensure that kids are learning every day. So no, but you're absolutely right. We need to include the academic outcomes.
I saw we had one more hand in the room, but is there anybody online, do you see? Okay, thanks.
Well, thank you, Erin. This was so phenomenal. I am familiar with your work, but seeing it laid out like this, the timeline, the relationships, the culmination of it all, it's just fantastic. And I'm really struck by so much of your work is defined by these long-lasting, deeply collaborative relationships that you have invested so much in. And that makes total sense to me, knowing you personally as a mentor. But I feel like there's so much work behind that's just not seen here to maintain these relationships. And would be curious to know, how do you approach finding these partners, and how do you maybe more importantly approach maintaining these relationships that have just been rewarding for you personally, but also for Maryland, for Baltimore, that have led to so much progress and important work?
That is a really good question. So my belief when you're building a partnership is that you need to do a lot of work on the front end to show you're a good partner. So you schedule the meetings, you send them the Zoom invites, you send them the notes after, you offer to write the grant, you offer to do a lot of the work to show your worth, because they don't need to partner with you. I mean, other academics do similar work, and so you need to really show that you care, but show that you're willing to do the work for this effort to move forward. And so that's been a big part of kind of how we've built these relationships over time. And we've seen my strong colleagues at MSDE, they've almost all turned over in the time that I've worked with them. So now they're all new, but I've been working with them all the time. I was just in a meeting with one of my strongest partners right before this lecture, but she came halfway through my partnership with MSDE. So I think that if you prove yourself early on and continue to prove yourself as a good partner, your reputation builds, and then you can maintain that even if even there are new people, because that's the fear is if you're working with just one person and then they retire, they leave, then poof, it's gone. So it needs to be kind of an embedded, institutionalized partnership. And that's what we've really tried to do with these different groups. And so.
Great, thank you so much. Any last questions before we wrap up? Okay, not seeing a hand up, and no comments on Zoom. Let me just say again, thank you so much, Erin, and ask for you to please join me in thanking Erin for an amazing talk, and thank you for all the great work that you have done and will continue to do to support children's health and well-being and their ability to thrive. So thank you so much, Erin.